Hi, my name is Alyssa Buchanan, and for Nursing 472, I completed my practicum hours at Norton Healthcare, which is located downtown Louisville. I currently work there in the OR department, and that's where I completed my practicum hours with my nurse manager. When discussing topics for my project presentation, we decided to cover the topic of our count policy change, which is something that was current and we were discussing it already, so it was perfect. And a few reasons why we needed to update our count policy was due to retained surgical items. The Joint Commission ranked retained surgical items number 3 in the top reported sentinel events in last year. We have had a few retained surgical items happen within our facility or our sister facilities. Although I wasn't able to use those specific statistics in my presentation due to confidentiality, I was able to use general facts about retained surgical items and give a little insight about things that have happened within our facility. Also, AORN guidelines for count policies have changed, so we needed to update our count policy to decrease the likelihood of having retained surgical items occur within our facility. Objectives of my presentation was for attendees to understand the need for the count policy update. I gave, within my presentation, I gave potential consequences of retained surgical items, cases where there's an increased risk for retained surgical items, and I also showed a short video of a few patients' perspectives on how this sentinel event could affect their life. Another objective was for attendees to understand what times of the procedure warrant the need for a count, and also for the participants to know what items must be counted during different procedures. For my presentation, I used a PowerPoint for my visual aid, and within the PowerPoint, I showed the video of the 2 patients who had the retained surgical item following surgery to explain how it affected their life long term. I handed out and displayed within the presentation a visual of the new count boards. We used to use a clipboard and a paper for our count, and now we are going to a count board so everyone in the room can visualize the count board. I handed that out as well as included it in the PowerPoint. I also handed out a printout of the PowerPoint so they could take it home and review, or if they forgot anything, or to just follow along. And I also handed out the evaluation sheet following the presentation. Pertinent issues from the literature used within my project was the statistics from the Joint Commission, which they had started. The statistics began January of 2017, and it was from January to June of 2017, and that was when there was 41 reported sentinel events of retained surgical items that were reported, which many believe that this is underreported due to the delay in side effects on patients and because of facilities' reluctance to report because it might look bad on the facility and lose patients. Also, the Association of Perioperative Registered Nursing Journal in 2014 found that if safety precautions remain at the forefront, even in emergency situations, there's a quiet count environment, ensuring one of the 2 individuals participating in the count will be present at the final count, and reducing OR traffic to all decrease the likelihood of retained surgical items. In 2016, the Journal of OB and Gynecology found patients typically present with flu or virus-like symptoms, which is a main reason why they're misdiagnosed and the problem proceeds. They present with abdominal pain, nausea, vomiting, low-grade fever, and constipation. And then as time progresses, worsening symptoms include unbearable pain, fistula, obstruction symptoms, extrusion, sepsis, and possibly death. The majority of my audience were nurses who work with me in the OR, as well as the scrub techs, because they play a huge role in our count process and ensuring that nothing is left behind in our patients. My evaluation contained 6 questions, and I printed it out. And gave it to my attendees. There were 7 people that returned my evaluation, and it was one of the. Oh, sorry. It had 6 questions on it, and they could check whether they strongly agreed, or were neutral about it, disagreed, or strongly disagreed. And they were able to, put checks or crosses or whatever in as their answer. And when I tallied it up, the first question was presenter cover topics needed to achieve the objectives, and 6 strongly agreed and 1 agreed. On the question of I feel I understand the need for the count policy change, 4 strongly agreed and 3 agreed. I understand the consequences of retained surgical items, 6 strongly agreed and 1 agreed. Presenter explained information well, all 7 agreed. Information presented was clear, all 7 strongly agreed. And presenter was comfortable and familiar with the topics, all 7 strongly agreed. The main points of my presentation was to give an explanation as to why the count policy needed to change, which was the retained surgical items and their consequences. Discuss the major changes that will be seen within the new count policy. Explain when and what to count, and to give reassurance that change is difficult for everyone but also necessary at some time. The reflection of my practicum. All in all, I enjoyed the opportunity in using my facility and my department for my practicum site. It allowed me to gain insight to all the responsibilities that I had no idea our manager was responsible for. It allowed me to see things from my manager's side and not just from an employee side. I was able to attend several meetings, and one being the safety meeting, and that was where all of the managers met and discussed PSRs, which were our patient safety reports that were put in, and it just reassured me that whenever I do have to put in one of those, that the issue is taken care of and it's not just lost somewhere in another piece of paper that I had to fill out. It was more comfortable and reassuring that I was able to follow someone that I'm comfortable with, so I was able to ask questions. I didn't feel uncomfortable with talking to her about, the meetings or questions that I had, that she was, anything that had to do with her, I wasn't uncomfortable or scared to ask, like that I normally would be, if I was with someone that I wasn't familiar with. I think my presentation went well. Sometimes whenever our managers change things or change policies within our facility, they just say what's going to change and don't really give an explanation as to why they need to change. And I feel like my presentation helped do that a little bit, to have people understand, because if you understand why something needs to change, then I feel like you would be more apt to change. If I could change anything around my presentation, I, for one, would be the one to press the record button during my presentation. I had a little mishap and had someone else press the record button for me when I was presenting, and my first video actually didn't get recorded, so I had to do my presentation over again. And the second thing I would change is to not schedule my presentation the day before a holiday. I did it on July 3rd, so everyone was really excited to get off work and leave for 4th of July, so I feel like I would have had more attendees if I wouldn't have done it the day before everyone was excited to be off work. Overall, the Nursing 472 will change my practice because of the information I learned when researching the need for the count policy change, and the importance of following the policy, as well as understanding how much Jill is responsible for, and knowing, every time that I go to her office and she isn't in there, wondering, what she's doing or I'll understand how many meetings she's responsible to go to, that she's doing ground rounds on our patients that we perform procedures on the day before, and all the things that I was able to do with her. Thanks.